Okay, well, let's maybe give it one more minute, but we have, if I'm remembering correctly, we decided that we're not going to have everyone introduce themselves verbally, but I welcome everyone to introduce themselves in the chat, in the chat box with your name, your affiliation if you'd like, your title if you would like. And then we are still doing, having CAC members introduce themselves verbally, correct?
Correct.
Yeah. Okay, well, I'm Brad Porterfield. I'm the chair of the CAC. I'm also consumer representative and executive director at the Latino Community Association. So let's go through our, you want to help, Kelly? Call folks out.
This is Elizabeth Schmidt. I'm the chair CAC person, and just said happy afternoon.
Elizabeth.
Great, let's do Mandy and then Miranda.
Mandy, are you there?
Hi everyone, Mandy Seeley. I'm in Sisters. I use she, they pronouns, and I am a CAC consumer rep. And I don't know who's joined. I can't watch because I'm driving Hilton, so I can't see the chat or anything during this meeting, just FYI.
Good afternoon, everyone. My name is Miranda Hill, and I am a CAC representative, and I am here in Klamath County.
Next, we'll do Stacy and then Natalie.
Hi, I'm a consumer rep. I live in Redmond, and yeah, thanks.
Hi, I'm Natalie, Jefferson County Public Health and CAC member.
That does it for our CAC members.
Okay, and then we're also inviting any guests to introduce yourselves. So it looks like, I know Leslie Cano is a guest. She's our new advocacy coordinator. So Leslie, you want to introduce yourself?
Yeah, thanks, Brad. Just like Brad said, I'm the new advocacy coordinator at the Latino Community Association. And my goals are to just kind of help advocate towards issues or anything that impacts the Latino community, either in a negative or positive way, just trying to overcome any obstacles that may impact our community.
Thanks, Leslie. Who else do we have? Kara Nielsen?
Hi, I'm Kara. I'm a BSN student, and then I'm also the school nurse in Culver, so just kind of learning about the resources in the Central Oregon area.
Nice. And what's BSN? Sorry.
Oh,
BSN?
sorry, bachelor's in nursing. So I have my associates and just finishing up my bachelor's. So thanks for allowing me to be here today.
Yeah, welcome. Anybody else a guest today? I can't see him. What's the best view to be able to see everybody? Having a heck of a time. We have Ken Provencher.
Yes.
Ken?
Hi, folks. I'm Ken Provencher. I'm CEO of Pacific Source. I try to sit in on each of our CACs across our 5 CCO areas every year. And so I'm just here to listen and take away what's important and on your minds. So thank you for letting me be here.
Thanks, Ken. Welcome. Anybody else who is a guest or joining us for the first time?
I believe that's it for our guest, but we also had Teresa, our CAC member, join as well. Teresa, if you want to just say hello.
Hello. I'm sorry I'm late. Just it's a day. Anyway, I'm a community representative, or I forget my title. moving on.
It's good to have you back, Teresa. All right, with that, we'll go ahead and move on. Is there someone who would like to have the honor of reading the land acknowledgement? Anyone? It's here on the screen. Anybody? Going once.
Brad,
Okay.
this is Kristen from Pacific Source. I can read it.
Fantastic. Thanks, Kristen.
I apologize for any background noise. We recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We inspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Thank you, Kristen. And then the meeting practices, we just, most of you have been joining these meetings for quite a while, but if you have not, if you're a guest or you're haven't been with us for a while, we'll put those up on the screen. And I'll just say you're welcome to please read those. And in general, we're just trying to make, doing our best to make these meetings a little bit less formal, use plain language, try to avoid acronyms, try to avoid weird words like minutes. Yeah, just kind of make it comfortable for everybody as much as we can. So just take us a minute to read through these yourselves, please. And feel free to call out such things as if I, as the chair, don't remember to reach out and ask you to participate or anything. If you see anything on here and I don't follow the rules, let me know. If I could do better, please speak up. With that, let's move on to public comment and patient story. Do we have a patient story? I don't think we do, but if we do, anyone who would like to share a patient story or make a public comment?
I would like to make a public comment. This is Elizabeth Schmidt, and I've been having trouble with my Assurance phone. I finally found out that they're not dealing with things in Oregon, and so one of the companies that they named is Verizon, and so I need to get that signed up, but it's been a long process. Is anyone else having the problems with Assurance and so-called Obama phones?
Obama phones. Is anybody else having that experience? So you're just not getting customer service, Elizabeth?
You totally cut off. And then if you want to use Assurance, you can pay for it. But the free service is, I found out, with Verizon, and they named 2 other companies. And so I don't know, I've had so many problems with medical situations, a person in the family dying, just feeling overwhelmed. And so I'm just processing slowly things. So that's, I couldn't seem to follow the directions.
Okay, well, looks like Kristen put in, are you able to see the chat, Elizabeth?
I'm not good on the chat. Let's see.
You can click on the chat, little speak out
Elizabeth,
box.
this is Kristen from, oh, I'm sorry, Brad.
No, go ahead.
Oh, this is Kristen from Pacific Source. I can share my contact information with you, and I'm happy to help you walk through this process if you'd like.
That'd be great.
To help you get back on the Lifeline phone. Okay,
Yeah.
I'll have Michaela and Gwen share that with you, and then you can reach out and I can help you navigate that process.
Thank you.
Thanks, Kristen. Any other public comments? Okay. Well, let's go ahead and move on to our follow-up on our combined meeting last week. We had the combined Health Council Board and Community Advisory Council members meet together. Some of us met in person, some of you met through Zoom, but we were all in the room together. That was pretty cool. Nice to be in person and to have the large screen and camera and so forth so that we could have a hybrid meeting. I think it went successfully. Did it go successfully? Those of you who are on Zoom, did you have a good experience? I forget who was on Zoom.
I was on Zoom. I really couldn't hear a lot of what Donna had to say. It was gargled, but I caught part of it and I heard a lot of laughing. I didn't hear a lot of comments that led to the laughing, but so I think some help needs to be with the video, the voice. But it seemed nice. It seemed very nice.
No, that's good feedback, Elizabeth. Did anybody else have that same experience? Have any trouble with the audio or any other?
Yeah, Brad, this is Miranda. I was also virtual and I could hear, some people really well, but then, it's just one of those things. Unless there's microphones all throughout the entire room, it's just hard to hear some people. But overall, it was good and it looked like everyone had a great time. So I enjoyed it.
Thanks, Miranda. Was there anything else you wanted to cover with that? Was somebody on staff going to talk about the follow-up of the meeting, or what was we want to accomplish with this? Just to check in?
Yeah, check in, see what folks thought. Yeah, it was, the combined meeting was just a chance to get to know our new executive director and talk.
It's actually a good point. We should invite Carmen to introduce yourself. I guess not everybody.
I was gonna say Carmen is here today. Hi, everyone. Oh, do you want me to do that now? Okay.
Yes.
Thanks, Brad. Hello, everyone. I am Carmen Madrid, for those of you that have not met me yet, and I am the incoming executive director, and I'm really excited about working with this group. Probably my favorite is to work with community organizations, because your work is what drives the work here, and I really, really value that. So I'm looking forward to working with a lot of you, meeting you in person. So email me. I'll put my email out here, and I hope that we can begin to do this work together. And please be patient with me. I have a lot to learn, and I need to learn from you. So thank you.
Thanks, Carmen. And I saw that Connor joined us, CAC member. Connor, do you want to introduce yourself?
Hi, sorry, Brad. Yeah, hey, everyone. Carmen, I met a couple weeks ago, so but I'm a CAC member and work for Family Resource Center, and apologize for being late today.
Just glad you're here. Thanks, Connor. All right, did everybody have a chance to look at our notes from the April meeting? And if so, we just hope that those reflect what actually happened accurately or fairly accurately. No mistakes, like glaring mistakes or omissions. All right, CAC members, does anybody want to, Does anybody feel like those notes do not reflect the meeting? Or do you see any errors that need to be corrected? No. Okay. Okay. And we're good. The notes are good. Thanks. And we're going to move on now to our breakout sessions. Those of you who are new to the Community Advisory Council meetings, we spend 10 minutes before we kind of dig into business, getting to know each other in small breakout rooms. So Kelly, I'll turn it over to you.
Yeah, so today's question is really for our CAC members. Should future meetings be in person or stay virtual? So we have a few questions that you can consider during your discussion. What did you long for over the last 2 years when you couldn't come together in person? What didn't you miss? What did we invent over the last 2 years? What are the benefits of each option? What are some barriers you might face? And what might we experiment with now? And then our guest today, Pacific Source OHA, you'll also go into a breakout room and you can discuss any topic you would like. So you'll have about 10 minutes or so, and I've assigned everybody their rooms. So we will see you in just a bit.
Right. It's always nice to have those breakout rooms, I think. And check in. So how are we gonna, Kelly, how are we gonna, or Michaela, how are we gonna gather like the input? What's the plan for?
Yeah, could we have the CAC breakout rooms do a quick report out?
Yeah, who wants to go first? I don't know who's in which room, so. Miranda, do you want to report out on our group?
Yeah, absolutely. So I had, and I do apologize, I also have my dog here with me. He'll be good. But we decided, we really do like the options of being in person, but also for me personally, I'm in Klamath Falls. And so me traveling, each month would be extremely difficult. We talked about having maybe like a quarterly in person, nothing of course required, but again, that hybrid option just so people can, be where they're at and be the most comfortable. But we also understand that in person really does make a difference, and that extra networking and things that we don't get to do on Zoom, and Zoom fatigue is real sometimes. So I understand that too.
Thanks, Miranda. Is there another group that wants to report out anything different than that? Other thoughts? Stacy.
We also said hybrid meetings because it would be nice if we could go to a meeting in person, but with life and scheduling and traveling, that's not always possible. The other thing, are you wanting us to recap just in general or just that one question?
In general about meetings, I think, right?
Oh.
Meeting format. Was there something else?
Yeah, so yeah, we all decided or agreed on hybrid would be best if possible.
Okay. Mandy, were you in a different group?
No, but I'll just add on that we also talked about going into different communities and not always having them in Bend when they are in person.
Yeah, thanks. Elizabeth, Connor.
I was in the group with Mandy and Stacy and Elizabeth, so I'll ditto everything they've said.
Okay. Is there anybody else that has anything different to share or additional? Okay. Is that enough feedback for the staff? Yeah, all right.
That's great, thanks.
Okay, well, I think we have another guest, Ignatius Bao. I hope I'm pronouncing your name correctly, Ignatius. Do you want to take it over? Introduce yourself and.
Sure. So hi, everybody. Great to see familiar faces on the Community Advisory Council, and also welcome our friends from Pacific Source and from OHA that I see online as well. So this is a conversation about advocacy and lobbying, the L word, that sometimes is scary to folks in the nonprofit sector and in government. And I'm hoping that at the end of this hour conversation that we have together, that I will demystify some of what lobbying is and advocacy is, what you can and can't do. And at the end, you're going to realize there's an awful lot that you can do and very, very little that you can't do as a nonprofit organization, and that there's lots of opportunities to put forward the priorities in the Regional Health Improvement Plan and of the Central Oregon Health Council to the people that actually have the decision-making power and the budget power and authority to be responsive to some of those needs. And so hopefully you'll also be inspired by this conversation to think of different ways that the Health Council might consider, and particularly from the perspective of the Community Advisory Council as a voice of consumers in the region, to really make that a powerful place in which you can articulate and represent the people of Central Oregon. So a little background about myself is I started my life out professionally as an immigration and civil rights attorney, but please don't hold that against me. So I actually did a lot of this advocacy work and did training of other attorneys and other nonprofit organizations. I sat on a lot of boards around advocacy, and am continuing to do it and learn different ways of how to do advocacy and do direct lobbying as well. And I have been working with the Central Oregon Diversity, Equity, and Inclusion Committee for the past couple of years, and know some of you through that work. And so also have a great passion for making sure that equity is central to the work that you do, and so much of what I'm going to talk about and share and hopefully exchange ideas with all of you today is around how we can lift up equity in this work and in the advocacy that we do. So let me just start. If Kelly, you can share the slides. Really, again, I want you all to come out of this session feeling much more comfortable and feeling much more empowered and inspired to be advocates for changes in public policy. That's really all advocacy and lobbying is that we know that so much of what our communities face, community members face in terms of barriers to access, barriers to quality, barriers to good health and well-being are systemic and structural and policy oriented. They're not individual barriers. They're the conditions that government, industry, education systems, employment systems have created and that people find themselves in. And so in order for those systems and those policies to change, we have to advocate for those kinds of changes. So next slide. So to break this down, I break it down into the very simple who, what, how. So let's first talk about who, and I really invite, before I do the talking, who makes policies that you think are really important for the health and well-being of Central Oregonians? So who are those policymakers? And some of them are actually in this room virtually, but some of them we know are the usual suspects. So just open it up for popcorn style, just call out who are policymakers in Oregon that impact the lives of people living in Central Oregon. So anyone? Don't be shy. You're practicing advocacy. Who are policymakers?
City councilors.
City councilors. So most major cities will have a city council. In Central Oregon, you have a style of government in which you also have a mayor who sometimes comes from the city council and sometimes is elected separately. So who else?
Senators.
Senators. So specifically in what legislative body?
Both the state and the federal.
So we have the US Senate, and then we obviously have the Oregon Senate. And then the counterparts to that, the US House of Representatives, and the counterpart, the Assembly in the Oregon legislature. Who else?
County commissioners.
County commissioners. So that's something that we don't have here in California. We have county boards of supervisors, but in Oregon, you have a structure called county commissioners. And in at least one county, you actually call them a judge. So they're not a court judge, they're a commissioner of the county. Others?
Insurance companies?
So insurance companies are regulated by public policies. They don't actually make what I would consider, they make private industry policies, but they are an important policy and system for us to be considering. Yes.
And influencers.
And influencers of those, they're both regulated, but they also have a lot of money and lobbyists who try to influence policies as well. So others? So what about in some of the other areas of work that you do in terms of housing or in terms of education that the Regional Health Improvement Plan touches on? Who might be some policymakers that oversee policies and systems relating to education or housing?
The Oregon Health Authority.
So obviously the Oregon Health Authority is going to be the really important agency. And in Oregon, the Oregon Health Authority is primarily the Medicaid organization, but now it has also taken over responsibility for the Affordable Care Act marketplace, which regulates the Affordable Care Act plans, and is now also under its umbrella, the state retirement system that provides healthcare insurance for state employees, and that also includes local employees. And so that's another important function that they play. And then the folks at Pacific Source know they also perform these quasi-regulatory roles in convening, for example, the value-based payment compact, in which it's trying to get all payers in Oregon, both the public payers that I just mentioned, as well as all the private payers, the insurance companies, to move together towards greater healthcare value. And so that's a convening role that they play in a quasi-regulatory way. So other agencies, particularly around housing and education?
HUD.
So HUD, the US Housing and Urban Development Department, provides vouchers, provides rent subsidies, is responsible for housing development oftentimes in coordination with local housing development and redevelopment organizations. So what about finally education? Who governs, who regulates, who provides public policies around education?
Federal and state.
So what are some of the federal agencies?
Federal, is that the Department of Education?
So the Department of Education provides, particularly for the populations that the Health Council is looking at, low income students receive, that school district and that school will receive federal funding, not related to education, but related to some early learning outcomes, are actually the US Department of Agriculture, which oversees school nutrition programs, school breakfast and lunch programs, and that's really important for learning and for their health. And then the Department of Education also provides really critical scholarships for colleges and universities. And if we keep going, also through partnership with the Department of Health and Human Services, through something called the Health Resources and Services Administration, also provides scholarships and support for health professions development. So people interested in becoming doctors and nurses also get support from the federal government.
What about Healthy Schools? Is that a state program?
So Healthy Schools is probably the state Department of Education, and then obviously at the local level, you have school districts and school boards, and they're also elected and make policies for their local districts and schools. So we've touched on a whole number of different ways. So let's talk a little bit about the how question. How would you, we've named lots of different policymakers, how would you influence their policies? What are some ways, and if any of you have had that experience and are willing to share about that, that would be great. So who has had contact with a member of the legislature or a city council person or a school board member or someone working at the Department of Education or someone working at OHA? We have some OHA staff here, but who's had contact and has engaged with folks in those positions of policy making? If anyone has any examples.
So I haven't had any direct contact, but there are groups that I am with that I get an email sometimes saying, hey, please reach out to this representative. Here's an email that you can customize and then you send out. So I've done that a couple of times, but I've never been directly approached a person.
Great. And Mandy?
Advocacy is kind of my thing. So I talk to legislators every year on Capitol Hill Day for housing and homelessness. And I work with a statewide group of advocates, and we have our own Oregon Capitol Hill week where we talk to them. And then I frequent the city council meetings here locally in Sisters and advocate for stuff here as well.
Great. And Mandy, if you are able to and willing to, can you share an example where you felt you were heard or effective, that you changed somebody's mind in one of those meetings that you had with a legislator or when you attended a city council meeting?
Unfortunately, I have not felt that way. I'm either talking to legislators that already agree with me or ones that are never going to listen to me. So
okay.
As far as changing people's minds, I have not seen that yet.
All right. So we'll talk a little bit about, how to be more effective, and but that's probably a realistic experience that a lot of folks have when they first start this work. That they're either talking to somebody who's already on your side and agrees with you, or somebody that disagrees with you, and it's really hard to persuade them. But it's really important to make that effort. So others who've had experiences locally at the state level or at the federal level in Washington, D.C., or every federal representative has local offices as well. So it doesn't necessarily mean if you talk to a senator in the US Senate that you necessarily have to go to Washington, D.C. You could go to one of their regional offices as well. So any experiences that others have had? And I'll obviously open this up to Central Oregon Health Council staff and to our guests from Pacific Source if there's anything you want to share of experiences that would be helpful for the group as a whole.
This is Gwen. I think one of the things that I've noticed in having conversations at different levels of where policies are made and how who's impacted is that I don't always necessarily notice something at the time, but it's this like slow trickle up, trickle down influence. I've experienced that with some conversations with Wyden related to behavioral health. He comes and asks this group a specific question. The group of behavioral health providers may or may not be an interest of them, but then there's this other flow back. So sometimes it feels like a one-way conversation from both sides, but it's impacted decisions, work, focus of things. So it's a slow ooze.
Great. And the other point that you raised there is it's about relationships, so that if you are known as a behavioral health provider or having knowledge or experience about behavioral health, it's more likely that the senator or his staff is going to reach out to you and listen to you because you're on their radar, you're known. So again, it's all about building relationships as opposed to a cold visit or a cold call. So Carmen says you worked a lot with local and regional representatives around immigrant and refugee issues and migrant, other marginalized issues. Carmen, do you also want to share any specific experiences that might stand out for you where you were effective or you were spectacularly ineffective as well? It's also good to share.
Can't hear you, Carmen. Or I can't.
Sorry. Okay, so I have worked in Washington County before as an organizer, and we worked on the driver's license bill for undocumented communities, as well as detention, the 24-hour detention rule that was overruled by the Clackamas County magistrate, that it was unconstitutional. So lots of issues that people may not be aware of, and really informing communities that they do have those rights, and it's that communication also. So even though something passes, everyone needs to know about it. So
great, and
I'm very passionate about this work, so I hope to continue.
And that's a great point, that even if you are effective in getting a policy change, making sure that the people that it impacts know about it, making sure that the people that are responsible for implementing it, we'll talk a little bit about that in terms of administrative advocacy and regulations, that is also really, really important. And so in the case of the driver's license, did the Department of Motor Vehicles make those kinds of changes, or did it continue to make it hard for people who are undocumented to get their licenses? And so you can really get into the weeds and into the details, but that's also a really important part of advocacy. Any other examples that people want to share?
Ignatius, I would add that some of the advocacy we've done has not always been about taking a position. It's about positioning ourselves as a resource to then try to get folks to think through unintended consequences of legislation and things like that. So sometimes it's been more, here's what we know or what we think we know. And if you want to dig deeper into that, maybe we can be a resource in helping you do that.
Right. And so the other thing about how you influence folks is, I always say, facts and stories. So numbers and people. A lot of times people will ask, if we adopt this policy, how many people is it going to impact? How many people are affected by this? And again, health plans and CCOs are in great positions to sort of generate some of that analysis because they have access to that kind of data that oftentimes others don't. But I also repeatedly have had the experience that although you need to answer those questions, it's also the human stories, the actual person, that an example of who might benefit, who would be impacted by that change in a good way, that is also really, really powerful. And so again, if you are a community member and all you have are the stories and those experiences, you don't have the capacity to generate the data or the research, don't feel like you're not important or you don't have something to contribute, because over and over in my experience, it's been the story as well as the fact that will convince that policymaker. Back to Mandy's point that oftentimes it's really hard to ask people and convince people to change their mind, but oftentimes the story is the thing that actually changes their mind or opens their mind a little bit. So any last examples or comments that people want to make about their own experiences doing advocacy?
I'll share. In my previous work life, I had an opportunity to have a couple of listening sessions with Senator Wyden, specifically in sexual and reproductive health, which is where I spent the last decade focusing. And I really appreciated the idea of the stories, because that's really what he was interested in, was the patients, where they're traveling from, what their needs are, and how do we continue to protect those rights in that space. And then I also thought about the different times when people have come and asked, and those sometimes are knocks on the doors while people are campaigning. So also that sort of grassroots place where, prior to people being in offices, whether that's been a local school board member or city councilor running for office, to have a chance to have some of those early conversations to help shape some of the work that you could help influence ahead of them.
Great, thanks, Tricia. And that's also the advantage of a place like Central Oregon, that it is small enough that, again, there is a chance that somebody actually is going to knock on your door, especially if they're running for a local race. So again, getting to know folks, building those relationships is also really important, because like anything else, city council members go on to the Oregon legislature, who then go on to the US Congress. And so you can just never imagine where people and what kind of influence they may end up having in other positions as they go up the chain in that way. Great. Any other questions, comments, experiences that people want to share before I shift into a little bit of sharing some of the do's and don'ts and giving you some additional ideas?
Ignatius, I assume we're going to have a chance to chime in as you go along, so maybe we'll just move along.
Okay, great. All right, so Kelly, if you could go to the next slide. So you all have touched on this already. I often talk about this as, this is not your high school civics class, but a lot of this will look like your high school civics class. We were taught that there were 3 branches of government for those immigrants who had to take the US citizenship test in order to become a citizen. You also had to study all this and say how many members of the House of Representatives there are, and what the succession of the executive branch might be, and how many judges are there on the Supreme Court. So we're all familiar with this, that there's a legislative branch, Congress at the federal level that makes the laws, the executive branch that carries out the law. So again, the real importance of administrative work that changes the systems that Congress or the legislative body creates in a law, and how the executive actually carries that out. And then the judicial branch that lately has been in the news, obviously around Roe versus Wade and the reproductive rights fight, but also really important that courts increasingly also are this check and balance on the other 2 branches, but unfortunately is also becoming more politicized, just as the other 2 branches are as well. Next slide. And just to complicate this thing, I see this as multi-layer. So that structure of the 3 parts of government is replicated at the state level, and then again at the local level. And all this very busy slide is trying to say is there are places in which it overlaps, that the authority of who's in charge and who sets that policy can be in this Venn diagram, that sometimes there's overlapping jurisdictions among those 3 levels of government. And that it's really important for us to be thinking about where the appropriate level is, and who the target, who the focus of the advocacy effort might be. Again, as I said, I've been really fortunate in my life actually to have done advocacy. I was thinking about this at all 9 levels, so that I've been in court, in state court, local court, federal court. I've been testified in front of city councils and state legislatures and Congress. And I've actually helped shape laws in terms of local government, state government, and federal government as well. All right, so Buffy says, You should add tribal governments, and absolutely, we should add that's another whole level of government that interacts with the federal, state, and local governments as well. Thanks, Buffy. Next slide. So the first rule, if it's a rule, is that you can do absolutely as much advocacy with the executive branch as you want. So you can meet with them. There's no limitations if you're a nonprofit organization or a tax exempt organization. You can submit comments on their implementing regulations. More and more, the federal government is doing something called request for information, which is, we don't know what the best public policy is. Give us your ideas. And so there was a great request for information from the Federal Office of Management and Budget, which oversees budget requests for all the federal government. President Biden had issued an executive order that said we want to infuse equity into all of federal government activities. And so the OMB said, what are people's ideas for how we could integrate equity into federal government work and federal government budgeting processes? And then they actually responded and said, here are the ideas that we heard, and these are the things that we're going to try to implement. You can actually affirmatively make requests and say, we don't like the current policy, please change it. Or we don't like the way that you're allocating budget funds for housing, for transportation, for education, please change it, or please prioritize this rather than that. And then finally, and this will become important in terms of the legislative advocacy, is that you can ask other people to do this. And that's unlimited as well. So you can be a community organizer, you can be a coalition builder and say, come join me in this work. If we do this together, we'll have more of an impact. We'll do a sign-on letter, we'll do a joint visit, we'll do a joint video conference with other groups, other organizations, other individuals. Next slide. So who would the targets of some of this be? At the federal level, we've already talked about this: Health and Human Services, HUD, Transportation, Homeland Security, for Carmen, which sets immigration policy, Department of Agriculture, that we don't think about, often sets food policy for food stamps or SNAP, for the school nutrition programs. Stacy says, what about Environmental Protection Agency? I didn't list all the 30 federal government agencies, but yes, whatever the right agency is, and oftentimes they'll have overlapping jurisdictions over these issues as well. Next slide. And then obviously we have to get into the details a little bit. This is very busy, but for those of you who are interested, this is the organizational structure of the Department of Health and Human Services. And so later when we talk about periodontists, it's okay, we know that this is an issue. Who do we go to? Do we go to the Centers for Medicare and Medicaid Services, which pays and sets federal policy about what Medicaid would pay for? Does it pay for periodontal care? Or should we go, as I mentioned, to the Health Resources and Services Administration on the second column all the way to the bottom, which, as I mentioned, provides money for workforce development, for actually training and educating new dentists. And so again, there are different parts of the agency that we might want to target and focus on in terms of our advocacy. Next slide. And then similarly, when we think about the state has the counterpart organizations. And so we've talked about the Oregon Health Authority, but obviously there are these other departments, these counterparts to the federal agencies that are here in Oregon. Next slide. And then similarly, if we're going to do this work, need to understand the way that the Oregon Health Authority is also organized, that they have a tribal affairs director, but then they have all these different divisions. They have a division of equity and inclusion, which might be the subject of or the focus of some of the advocacy. They have a public health division that oversees the public health departments. They have a health policy and analytics division, which oversees broad health policies. And then they have a health systems division that particularly look at quality and other things within systems. And lots of different parts of OHA that might also be where you want to focus your advocacy. Next slide. And then this just gives you an example of within the health policy and analytics division, They have all these committees. Some of you serve on some of these committees. It's a alphabet soup of different committees with different areas of subject matter and topics. And so these are also places that, again, even though it's a board or a committee or a commission or a work group, this would all be considered administrative advocacy. It's not legislative. And so again, any interactions you have, any communications you have with these committees, going to these committees is all considered administrative advocacy, which is unlimited, that you don't have to really worry about running into any problems with the Internal Revenue Service in your tax status. Next slide. And then finally, at the local level, you have some representatives on the Health Council and in the CAC from the county health departments, and they're each organized slightly differently. And so again, there may be some very local policies related to COVID, related to other things that obviously are much more at the local health department's place of policy making. So let me stop there and go to the next slide and ask, again, now that I've run through that, any examples that people want to raise of things that you could do that has come up in the CAC that might be something that you would want to do administrative advocacy around. So Rebecca from OHA shared, some of you are familiar with something called the 1115 waiver, which is to give the state permission to do some things different than the usual Medicaid rules. And there's a 5-year proposal that created the coordinated care organizations. And this latest request for an 1115 waiver was just submitted. And we're hoping that the Centers for Medicare and Medicaid Services approves it. But again, it's completely appropriate if the Health Council, if the Community Advisory Council, if you as individuals wrote to the Centers for Medicare and Medicaid Services or called them and said, we really support what Oregon is doing, that would be a form of administrative advocacy. So any ideas?
Rebecca, oh, sorry, Ignatius.
Go ahead, Brad.
Ask Rebecca if she could mention something from that waiver that's like just one significant, pull something out that's a significant change or request or.
Yeah, so there's a part of the waiver that expands coverage to folks to eliminate, to actually smooth transitions. So if folks are currently, if someone becomes incarcerated, they lose their Oregon health plan status. And then when they come out of incarceration or jail, let's say they need substance use treatment or mental health services, there's a delay. They have to reapply to get Oregon OHP benefits. And so one of the things in the current waiver is to find a way to smooth out those transitions and to allow people to either maintain their coverage while going through a transition, like going into the Oregon State Hospital or into incarceration, or to quickly turn on those benefits again when they leave the hospital or leave another setting, so that there's no disruption and that people can get the care they need. So really trying to, there's also the bridge plan, which is looking to provide expanded coverage to folks. So with the redeterminations that are going to be happening, making sure that there's continuous coverage for folks. Another piece that's in the Medicaid waiver is with the community benefit investments, having a community voice in decision making. They're looking at how they can enhance sort of equity in that decision making and bring in additional voices into the decision making. And so lots of things that touch the work of the CAC, and certainly important to Oregon health plan members and families. And so Those are just a couple of examples. And
And
I'll put the link to the waiver website into the chat.
And just to reinforce that last point that Rebecca made, that it's a 3% requirement that the coordinated care organizations would have to put 3% in community investments, and that they would be community decided through a community participatory process, such as the Health Council. And so it would significantly increase the amount of resources that our community decided. All right, so any other comments about administrative advocacy or questions? All right, so let me go quickly to the next section, which is judicial advocacy that you may not be thinking about a whole lot. Again, you can do unlimited amounts of advocacy at the federal, state, or local court level. You can file challenges to government action or inaction. So you can challenge, so Carmen mentioned one challenge to a detention policy that was raised in litigation. Obviously, the litigation will continue around reproductive health if the Supreme Court overturns Roe versus Wade, that it will probably not be here in Oregon, but in other states that will play out. We're seeing, unfortunately, lots of laws being passed about transgender health and transgender care by state legislatures, and those are also being challenged in court. You can do something called an amicus brief, which is signing on. And so even though you're not a party to the litigation or to the legal case, you're taking a position. And oftentimes that's with other organizations, and that's a really important advocacy strategy. And you can also participate by submitting testimony if the litigation is around behavioral health services and how they get funded. So back to Gwen's example, if you're a behavioral health provider and you have some testimony that would be useful to the court, you could either testify or submit a declaration in writing that would be useful in that litigation. Next slide. So then obviously we have the Supreme Court, we have district courts, and we have state courts that you could do this. So any examples come to mind of litigation? This might scare some people, but it's something that you could do as a nonprofit. Nonprofit organizations can sign on as parties to litigation, can sign on to amicus briefs, and that's another way of making the case for changes in public policy. So any comments or examples around this?
Ignatius, I'm pretty sure immigration reform would fall into this, wouldn't it?
Absolutely, and I'll give one related issue that actually originated in Oregon. One of the executive orders that President Trump issued while he was in office was requiring new immigrants coming into this country to demonstrate that they would have health insurance before they could get their green card or their permanent residence, which was the circular, nonsensical policy, because if you're outside the country, you can't get health insurance inside the country. That's the whole point of you trying to get to the United States. And so there was a challenge filed in the District of Oregon in the federal court, and that court blocked that policy. So it never got implemented. So this was a case in which a federal district court in Oregon blocked this national policy, obviously to protect the immigrants who would have otherwise been harmed by it. All right, great. So I'm gonna, in the interest of time, move on to the third area, which is the area that most people think about advocacy and lobbying. Next slide. And here's where the rules come in. Next slide. So this is the one detail that you might want to take away from this is this three-part test that you're communicating with the legislator, a specific person or staff person, that you're discussing a specific bill or legislative action that includes a budget that is before the legislature, and you're taking a position. So back to the who, what, and how. All right. So it's a member of the legislature that you're communicating with. What is it about, a specific bill or action, and how you're telling them yes or no, support this or oppose it. All right. or it's a call to action to somebody else to do those three things. So when Brad said he got those emails, call your senator, again, specific person, take a position on a specific bill, yes or no. All right. If you don't do all three of those things, it's not lobbying, but then think about it, it's then not very effective. All right, so let me give you some examples. Next slide. So here are your current federal representatives, Representative Bentz, Senator Wyden, and Senator Merkley. Next slide, and let's just use the Build Back Better Act that passed the House that is now pending in front of the Senate. It would be really important for Central Oregonians because it would provide free childcare, universal preschool. It would expand Medicare. It would give immigration relief to certain immigrants. It would create paid family and medical leave, and it would allow for negotiation for drugs under Medicare, among many, many other things. Next slide. So let's say we want to lobby Senator Wyden on this. So the three parts: calling Senator Wyden, emailing him, texting him if you have his text, saying the Build Back Better is really important. So please vote for it. So I'm doing all those three things. Who? I'm directing it to a legislator. I'm talking about a specific bill, and I'm taking a position. Next. It's not lobbying if I call Senator Wyden and say, health equity is really important. Would you be a champion for health equity? But I haven't mentioned the Build Back Better bill, and I haven't asked him to take a position. So again, this isn't a very effective communication because he's not going to do anything. Even if he says he'll be a champion, that doesn't mean very much. All right, so this is a contrast of what lobbying is or is not. Next. And then asking other people to do that, we call grassroots lobbying rather than direct lobbying, which is please contact Senator Wyden, tell him Build Back Better is important, and ask him to vote for it. Similarly, next slide. It's not lobbying if I say, call Senator Wyden, tell him health equity is important, and ask him to be a champion, but I haven't mentioned a bill or a position on a bill. All right, so are folks following? It's the who, the what, and taking a position, the how. Next slide. So this also applies to the Senate, and here are your senators in the Oregon Senate. Next. And your representatives in the Jefferson, Crook, and Deschutes County. And then as folks mentioned, next slide, this also happens at the local level with your county commissioners. Next slide. And your city councilors, I've just shown from Bend, Prineville, and Madras, who the city councilors are. Next. And then the final glitch here is, or the final rule is, if there's a ballot initiative, then it's also considered lobbying. So if you were for Measure 110, which legalized certain drug possession and provided money for more treatment, any money that you spent asking people to vote yes would also be considered lobbying. Next. So I'm just going to quickly go through in about 2 minutes next, the final rules about this. If you are a tax exempt organization, the rule is that you can't devote a substantial part of your budget or your organizational resources to influence legislation or lobby. So again, lobbying as defined by the Internal Revenue Service, contacting a specific legislator, talking about a specific bill, and asking them to take a specific position. Next slide. So the easy way around this, you have to report this anyway as a nonprofit organization on your 990 tax return every year. The easy way is to take something called the 501H election. Next slide. And what that allows you to do is have very clear rules. And the rule basically is that you can't spend more than 20% of your budget on lobbying. So if your organizational budget is $500,000, then you can't spend $100,000 on lobbying. So those of you who run organizations, Brad, you know that you're not going to spend 20% of your budget on lobbying. So you would never come under this rule. You have to report the amount, but you would never be over that limit of 20%. And then there's a special rule for grassroots lobbying that I won't get into. So all this is to say is that lobbying is permitted. You have to report it. Next slide. And this is how you report it on Schedule C of your Form 990 every year. Every tax exempt organization has to file this tax return, and you have to file the schedule to report your lobbying hours and time, and then have a calculation that Jane's 1.5 hours of lobbying was $500 worth of salary, and therefore under the $100,000 limit, and therefore completely permissible. All right, next slide. And then the final rules are about electoral politics, and Trisha talked about meeting candidates. So this is the one place as a nonprofit organization, as a tax exempt organization, you can't engage in any electoral politics for or against any candidate. However, you can do what are called nonpartisan activities, which you can list their positions, you can survey the candidates, you could hold the candidate forum, as long as you're not endorsing a candidate one way or the other. And that's also why if you are working for a nonprofit, you probably don't want to use that nonprofit's name to identify yourself if you are endorsing someone. You can obviously endorse and participate in the campaigns and give money even as an individual. You just can't do it in the name of your tax exempt organization. Next slide. You can do other things like register people to vote. Next slide. And get people out to vote, again, without endorsing a particular candidate. You just encourage people to register or to vote. Final slide, next slide. So this is just a summary. You can organize, you can educate, you can encourage voting, you can do nonpartisan voter education, you can lobby within the IRS limits, you can litigate, you can influence regulations. The only things you can't do are endorse political candidates and go over the IRS lobbying limits. So there's so much that you can do and so little that you can't do is the message that I want to send. All right, so let me stop there and see if you have any questions before we get to our final example.
Ignatius, do you happen to know the history of, because it's pretty peculiar, that nonprofits, like the main thing we can't do is endorse candidates. Do you know the history behind that, just briefly?
So the short answer is that there are so many other laws related to campaign finance that it was just a bright line that the IRS decided to draw. And it's that political contributions are overseen by other federal departments and agencies, and they just felt like nonprofits shouldn't cross that line. Obviously, for effective policy and advocacy, who those candidates are and who gets elected makes a difference. And so a lot of organizations form something called a 501c4 organization, which can do some limited endorsements, or they'll create political action committees. So they'll create other organizations that aren't their tax exempt 501c3 organizations to do that work. Other questions or comments about all this? All right, so in the final minutes remaining, let's take a next slide. In a previous meeting, next slide, you had some conversation about the lack of periodontal services under the Oregon Health Plan, and the fact that folks had to go outside of the area for those services. So here are some of the barriers. So what might be some of the policy solutions? Next slide. So there's clearly, and it's great the Pacific Source folks are on, there are clearly provisions under the Oregon Health Plan and Medicaid rules for transportation services to get to those appointments. And so there might be some policy changes that you want to advocate with the Oregon Health Authority or with the Centers for Medicare and Medicaid Services to expand those benefits, to make those benefits more comprehensive, especially if people have to stay overnight or have repeated visits at their limits. So again, that may be a place both at the Oregon Health Authority and with the federal government the Centers for Medicare and Medicaid Services might be something that you can look into. Next slide. And then what you also identified in your conversation was that there is a part of the Oregon Health Authority called the Health Evidence Review Commission that decides what gets covered. Then Oregon Health Authority also then sets the rates for the providers for those covered services. Next. So I went and looked, and the good thing is that basic periodontal services are covered. For those of you who know this, it's called above the line or below the line, that if the list of services that are covered are above that blue line, then they are included. If they're below, then they're not included. So the basic services are covered, the more advanced services are below the line and not covered. And so at least for basic coverage, you have that. If you want to advocate for moving more advanced procedures up the line, then you might want to do some advocacy with the Health Evidence Review Commission that is part of OHA to get those additional services covered. Next slide. And then obviously with OHA around the rates, which is a really challenging and difficult thing to try to increase the rates for all services. And then the final thing that you discussed was that there's just the sheer shortage, that there's only 35 of these specialists in the entire state, and that the local dental providers have had little success trying to bring them into the Medicaid reimbursement system, and that there's only one that would accept the referrals, but is not part of the Medicaid system. Next. And so another part of the Oregon Health Authority, the primary care office, is responsible for monitoring health profession shortages and drawing down federal funds. They just got an infusion of additional money, particularly for behavioral health, but also just to address shortages more broadly because of COVID. So they may be a focus for some advocacy to say, how can we get some more periodontists to come into this region, knowing that there's that shortage, or how can we get more just periodontists in the state overall, even if we have to travel to them. So those will all be potential targets for advocacy. And obviously, as I mentioned, then there's federal counterparts that support some of that work here in Oregon. So let me stop there and see if people have ideas or questions based. Hopefully that also helps how you analyze a particular issue and then try to decide what the focus of the advocacy might be. So let me open it up for questions and comments. So Leslie asks a question. Someone says that they're for a particular measure, and then if you amplify that message and repeat it, the implication is that you're also supporting the measure. So yes, that would count as lobbying, Leslie. And then Rebecca also points to the fact that the OHA Office of Rural Health may also be another focus for some of this work around the periodontal shortage. Other comments, ideas in our remaining minutes?
Ignatius, specific to the Health Evidence Review Commission, do you or does anybody else on this in the meeting happen to know what is the actual like most effective approach?
So they have a commission of folks that are looking at every single procedure, new drugs, new surgical procedures that come on, and they're deciding whether or not Medicaid in Oregon under the Oregon Health Plan are going to cover those. So a lot of it is reviewing new things rather than sort of going back and revisiting things, but they are open to, and they have an open public comment process, an open process to receive, again, back to, you can make an affirmative request to say they should look more closely at oral health services overall and periodontal services in particular to see whether or not they should make any changes in those coverage decisions. And then they have to go through a process of research of seeing what the cost is, what the effectiveness is, through some really complicated criteria. They produce that research, again, for public comment and conversation, and then make a decision whether or not they're going to change that above the line or below the line decision. Obviously, there's hundreds of procedures and services, so it's a very highly competitive thing on what gets above the line. There's over 400 procedures and services that are above the line already.
And Ignatius, as I'm sure you know, I mean, technically the clinical ranking of the procedures is supposed to be independent of the financial place where the line gets set, right? So technically it's you rank the procedures and then the line gets pushed down to whatever the budget can afford.
Yep. And so that's also where then you're working with both branches of government that, again, if we can get more money into the Medicaid program, but we're trying to control costs. And so there's other forces at work there.
So to be effective with the, again, specifically with the Health Evidence Review Commission, does it look like for the Community Advisory Council, write a letter, all the members sign it? Do you go attend, go in person? Like, what's the actual?
So my recommendation is actually to use the public comment process. And as Rebecca says, they're open to that. So, draft a letter explaining you've already created sort of the content of that in the minutes and the notes that you've had about this conversation, and say, we really think that this is an issue, not just for Central Oregon, but presumably for other parts of Oregon. Certainly for Eastern Oregon, it's going to be an issue. You might reach out to some of those counterparts, some of the counterpart CCO, CACs, working with Eastern Oregon CCO, for example, and have them sign on so that it's more than just the Central Oregon Community Advisory Council. And then I would send them a letter and then go attend one of their meetings and make a public comment and ask them for a response.
Brad, this is just a suggestion. This is Rebecca, OHA Innovator Agent. The Health Council might consider talking with the Oregon Oral Health Coalition, which is made up of schools, Head Start programs, FQHCs, federally qualified health centers, and the dental care organizations. And they have their own advocacy sort of prioritization and agenda. It could help you align with some experts. There's the School of Dentistry that participates at OHSU to help you sort of gather some evidence around the need for expansion of periodontal services. And it might strengthen sort of your advocacy, whether then you advocate on your own as the Health Coalition or with the Oral Health Coalition or both. But it might be a way to connect with experts in the field to sort of help develop the Health Council's positions in any of these areas.
And who's the main person involved in that in our region? We don't hear much about that coalition.
I can find out about that, Brad. I'm not sure who the executive director is right now, but I'll look that up for you.
Okay, thanks. Well, thank you, Ignatius. I think we do need to move on. Really appreciate you taking the time though to meet with us and share your experience.
Great. Good luck and go be advocates.
Thanks a lot. So yeah, we're gonna move on now. First, I want to thank everybody for being willing to meet for another half hour. We did agree as Community Advisory Council to try to keep our meetings to the hour and a half, but that we were willing to extend when needed. So we need to spend some time talking about the community health projects. So I'll pass it on to Michaela.
Thanks, Brad. All right. All right, so we have quite a bit to cover today in a short amount of time, per usual. But I wanted to start off with Stacy's going to give an update on the Cac Sub Group that is or has met a couple times And this group is really looking at the application process and making sure that it's more streamlined, more inclusive, less burdensome for the applicants, and then kind of go into some follow-ups and have a focused conversation around priorities. Sound good?
Yeah.
Okay. Stacy, do you want to give an update?
Yeah, so at the last meeting, some really important topics came up with inclusive, cultural humility, things like that. And what I took from it, or to try to recap the best I can, was looking at the wording and the language that all people and cultures in our community are feeling like they're included and understood in the process. And that also looks at the way that we are processing the applicants or their applications in general. I don't know if that's a good summary, but we also brought possibly even doing training or something, just overall need to touch base with the rest of the members.
Thanks, Stacy. Questions? One of the things that we talked about at the meeting, and Buffy offered to gather some feedback on the application and process from a tribal lens. And so, Buffy, did you want to share more about that piece?
I can share with you guys kind of my thought process, and I will let you all know that this meeting that she's discussing just happened, and so I have not had a chance to meet with some of the applicants that I know of to get feedback. So the thought process is that when the application was reviewed, when you're talking about sovereign nations, some of the questions didn't necessarily apply. And so my participation in the group discussion was simply, how do we begin to educate our CAC members and give them enough information so that they can see and learn about, the fourth, quote unquote, forms of government, which was, you guys just were exposed to 3, and how to advocate. And so there's this gap, I think. And so I was just sharing from my perspective that when I listen to the CAC meetings, sometimes it seems like I need to do a better job at trying to show up and say, okay, well, that doesn't apply in Indian country, or, oh no, that's not necessarily true for tribal people, or to just try to learn how to better inform so that when you guys are all sitting and making these decisions, that you're equipped well. And so, so in the beginning, like of the application, I don't even think we got very far when we looked at the language of where it says, choose the town that you want to, or you're conducting your project in. And I just said something as simple as, well, why don't we change it to community? Or are we not building community? Are we trying to build community? I'm still trying to understand that myself, because of the perspective of tribal people aren't necessarily always viewed as community. Oh, the reservation, they get money. Why do they need our money? And so it's a them and us conversation with bordering towns, or community funds, or even county dollars. And so I was just, that's pretty much what I was saying. And I can, once I get with the people, I can surely report back and share some of their experiences. I have no problem with that.
Thanks, Buffy. I know when we were in our small group, the small group was, all for it and really welcomed that feedback. How's that sound to the rest of the group? I'm seeing nods, thumbs up. Okay. Thank you so much, Buffy. And we'll try to get another subgroup on the calendar within the next month or so. Okay. So now kind of moving over to the follow-up from last CAC's meeting. When we're talking about in last CAC's meeting, one of the questions was really, did you want to narrow the focus of the community health projects grant? But I really kind of wanted to shape this conversation around, what are the community's priorities? What are the CAC's priorities? So you all are responsible for investing this year about $345,000 into the community to address social determinants of health and health equity. These funds are meant to improve health and increase the quality of the community members' lives. Over the last couple of years, you've received a lot more funding requests than you had funds to invest, and so you had to make some really difficult decisions. So wanting to focus this conversation around what you think the community needs, defining the community priorities, and what that means for prioritizing certain populations. And this conversation will help shape the application process as well as funding decisions. And so I'm going to ask for questions on that, and then I have kind of a list of questions to ask you all to kind of get us thinking about it and to hopefully come up with some priorities. Questions of clarity before I move on? All right, so first question for you all. What priorities did you have in the past round of community health projects?
Sorry, Michaela, will you ask that again?
Yeah, so what priorities did you have at the last round of the community health projects for the last 2 years? What did you prioritize?
From what I recall, we prioritize rural, we prioritize tribal. What else do other people remember? I think I'm missing something. Connor, Stacy, is Mandy still with us? Miranda?
Those are the two that I could think of, Brad.
JC says behavioral. I know on the RFP we listed kind of most, what was it? Most affected by system barriers. All right, next question. Regarding setting priorities, what are some learnings from the past year?
I came in late, so I just came in for the review process, but I remember trying to review the applications, and that was fairly time consuming for me. There were some lengthy applications, and making sure I was fully understanding as best I could so I could try to force rank them.
What were some other learnings?
I think the other thing that maybe we forgot to mention it because it was just so ingrained in our process, but the equity piece was a big, factor, one of our main kind of columns of diversity, equity, inclusion. Then just recognizing that it's really difficult to weigh like who's addressing that. It's one organization or one project addressing that better than another. It's very difficult to tell in some cases at least. Mm-hmm. So it's just one of the things that I found difficult, challenging.
So addressing equity. All right, so when thinking about community needs, what are some events that you recall in the past year that either hurt or helped the community?
Can I ask you to clarify, what do you mean by events? Just like broadly, community events, anything?
Yeah, I mean, flyers? Yeah, maybe
that kind of thing.
COVID.
Okay, yeah, so broadly, got it.
Things that happen in the communities, distance learning.
Yes, distance learning.
Michaela, can you rephrase that maybe differently, or Gwen, can you chime in to say it differently?
I think what we're trying to do with the question is kind of ask, if you think about your community or the communities in the region, what are some things that happened in the past year that either hurt the community or things that helped the community? To kind of get you thinking on what are some things that you may want to address in your priority setting, either pain areas, pain points, or some things that have been successful that you may want to consider prioritizing. Does that help, Buffy?
I think maybe one thing that's helped the community is, strangely, was COVID and the amount of dollars that federal and state were providing for different programs and services. And this year we might still get some of that, but that might be going away or being reduced. So that might be a challenge in the future. I don't know. I don't know if we'll have a smaller budget or not.
When you think of those services provided, which come to mind, like which pop up to you initially? Because there's a lot of them. So what pops out for you initially?
I don't have any specific. I just know that a lot of federal funds and state funds were flooded into communities to try to help with assistance for many different needs. So I don't have anything specific, Gwen.
Well, that's great, thanks. And folks, Medicaid and free school lunch for all children come to mind. Childcare, you all are putting some stuff in the chat. Distance learning is another one that came up as you generate that thought.
Within the schools, there's some funding in some of the schools for more reading help. A lot of feedback from in Redmond is how behind the kids are right now, and because of attendance, working with Ben Lapine School District, because attendance is down, they're actually going to be losing funding next year.
So schools losing funding, providing hotspots and internet for school children. Something that kind of comes to mind for me, and this could be completely off base, but I think of, something that hurt all of our communities was COVID with the, less access to treatment. I work a lot with substance use disorders and things like that. So the amount of people that are struggling right now and how much that's increased just in the last couple of years. And it's gonna get a lot worse before it gets better, unfortunately. Yeah. Overdoses are on the rise. Smoke from wildfires.
Well, they're not the tribes that I was in last year, but Warm Springs had their major water issues, right? Water supply issues.
I would add that that's also a concern for some of our community members in that North Klamath region. I'm sure it's not exclusive to that, but that's come up in some community conversations as well.
Mm-hmm. Wells going dry, is that what you're talking about? Yeah, with drought. All right, go ahead. I heard someone start talking.
I was just going to mention, I think it's related, but just how COVID actually in some ways brought us together, particularly across the state, but also kind of across regions where we don't interact quite as much. We've interacted through Zoom, strangely enough, but on the positive side.
Yeah. So kind of shifting, when we're thinking about priorities, who's most impacted by the decisions that you're making?
We're talking about the funding decisions, right?
Mm-hmm. Yeah.
Any health project, yeah.
I would say some of the most vulnerable in the community, if they don't get funding or if they do get funding.
Mm-hmm. Who's most impacted?
Trying to think of some of the projects we funded. So like Treehouse Therapies comes to mind. I think that was one of the later ones, but that impacts. I think they were focused on some of those students that kind of dropped out during COVID or might have started. Go ahead.
Oh, I was gonna say I have a few friends that use that service or have used that service, and it really impacts not just some of the younger kids who otherwise wouldn't have that behavioral health support, have that support which transfers into their classroom, into the families, and really helps them learn or grow or manage some of their challenges with their behavior that are not normally offered in other healthcare settings.
Thanks, Stacy. So when thinking about setting priorities or allocating this funding, what excites you about this?
What excites you about the funding opportunities that we're?
Yeah, allocating funding into the community, investing into the community, what excites you?
I think for me, it's when we put out these RFPs, we're reaching out to the community and then they're giving us feedback on what they see as a need. So it's helping me better understand where there are issues and where there might be areas for us to provide some help. So I think that's what excites me.
Yeah. What else is exciting or inspiring? Well, I know for me, I came into this, as a CAC representative just fairly recently, and I got, that last round of like Treehouse Therapies. I think it's inspirational just to see, these small grassroots organizations trying to do so much for our local communities. It's inspiring here at Public Health, like, wow, look at all these CEOs that are doing amazing work, and just how we can all work together. So what seems to be the most critical things to consider?
Community input,
Community input.
those that are being affected or those that are trying to help those affected, getting their input or buy-in, I think is important.
Mm-hmm. Stacy says widening our lens.
Stacey, could you share a little bit more about that? What do you mean by widening your lens?
Kind of going back to our subgroup meeting where we don't know what we don't know, and making sure, like Connor was saying, that we have community input and that we have everybody a part of our community, all diverse parts, having an input. That way we aren't funding or not funding or processing things in a, I can't think of the word right now to use, but just making sure that we have all bases covered.
Yeah, I would just add having a clear sense of where the needs are, and some sense of what the particular community that is requesting the funding, or not that's requesting the funding, that the particular community that's being served by the funding request, the project, that there be some sense that is the need. They're applying for funds to address a high priority need in their community.
Mm-hmm. All right, what else concerns you or is critical to consider? I want to leave space for Teresa and Elizabeth. If you'd like to share.
The most critical thing to me is the process has a systematic process to it that's very, very objective. Otherwise, I don't feel like it's fair to the people that apply. Because I think what's happened in the past is we started out trying to be really objective and we were succeeding. And then it became very subjective last year. And that really just came down to, I like this organization because. Now, I don't think that was fair to the people that applied, because then it's all about who knows who.
Mm-hmm.
And honestly, if it isn't objective, if there's not an objective process, then I am not going to participate.
All right, so being very objective in the review.
Yeah, I think that's what the scoring was. And then it kind of got thrown out the window, is my impression of it. Scoring with the rubrics, where we asked them to answer this question, this question, this question, and we scored it based on how well of a job they did. And then those were thrown out the window, in my opinion. So that's my 2 cents worth.
Thanks, Teresa. Elizabeth?
I'm here, I'm listening. I have no comments on this, but I have had comments today on various things. So I'm just listening.
Thank you. All right, so what priorities have been highlighted throughout this conversation?
Fair and objective process.
Fair and objective process.
Community input or buy-in.
Community input.
I heard something. Oh, go ahead, Stacey.
Oh, I was just gonna add, to those with the community or with objective process and community input, making sure all members of the community is represented.
Making sure all the community is represented.
I was going to share one of the themes that I hear you all speaking to is that the communities know best what they need to best serve their community members. As kind of an underlying theme, a thread through that.
The communities know best what they need. All right. All right. So if y'all agree, so what I'm hearing is fair and objective process, we need community input, making sure the community is represented, and then the community knows what they need. What do you think about those kind of as general, maybe not priorities, but principles? I don't know, things to bullets to guide our work moving forward in this process. All right, so I'll take this, we'll bring it back to the subgroup to kind of work on this a little bit within our process. And we are out of time, but the last piece of information that I wanted to get from you is that award range, and if you wanted to set an award range. So what I think I'm going to do is send out an email and just gather what your thoughts are on setting what you like to set as a minimum and a maximum for awards. So the max amount a project would get, and we'll take the average of all the answers and we'll bring that back to you next month to look at. Okay, I know we're losing folks. Thank you all for being here and holding on and staying an extra half hour. I hope you all have a wonderful Thursday.
Okay. Thank
Thanks,
you.
everybody.
Bye.
Take care.